Hello, everyone. Welcome to today's wellness break. My name is Crystalline Montgomery. For those that are new to our session or perhaps watching this at a later date, today we're going to be talking about optimizing digestive health and recovering from stress. What I'll do is we'll get into this in just a second. I'll give people who are just now joining us a couple of extra minutes to arrive. For those who are joining us for the first time, we've been doing these since the beginning of June, these wellness breaks, and each week try to cover a topic, a different topic. You'll notice there are some common themes throughout. I like to talk a lot about nutrition because there is a plethora of information about nutrition out there right now. And it's an attempt to try to make sense of all the information and misinformation out there. So we've had many different sessions leading up to today. Today's session is recovering from stress, optimizing digestive health. Next week's session will kind of piggyback onto this session, actually. We're going to talk about how to know what foods are affecting your body. What are your inflammatory triggers from food? It's a common question I get from a lot of people, and there are different ways to approach that. The week after that, August 17th, we're going to have a lovely guest come and join us. My colleague, Debbie Cohen, is going to be leading that session on daily practices to cultivate resilience. And then after that, we're going to talk about how to regulate cortisol levels naturally. And then to wrap up August, we may have another guest come in. Debbie might be joining us that session. We're working out the details of that. So just to give you a sense of what's ahead, and you can plan accordingly. As a reminder, for those who maybe can't attend live sessions, we are on YouTube, so you can always go back and listen to or watch a session after the fact. The videos get uploaded pretty quickly. The psychiatry department will send out a link every week for each video. However, you can also just go onto YouTube and search Psych Wellness. We have adjusted the YouTube channel so that it's public facing and there are no restrictions. So you should be able to get on and watch. So, whether you missed the session or you just want to watch it again because it was so exciting and you have fun doing that, it will be there for you. So just a disclaimer, just a reminder, I have no financial relationships to really anyone to disclose. So if you ever see or hear me mention something like a lab or a specific product, or I generally try not to do that. However, I have no financial connections to them. It's mostly just out of, experience or maybe patient reports. So no other connection. And as a reminder, these sessions are meant to be informational, educational. They're really designed. My goal is to try to keep people informed so that the more we're informed, we can go into our visits with our own healthcare providers, and it can sort of stimulate a discussion with them. If you have concerns about your own health, I might be talking about specific conditions or things that are relevant to your health, but obviously this is not medical advice. It's more just education, so you can take that on and hopefully have a good conversation with your own provider. So today we're going to talk about digestive health and why is this so important? Digestive health is something I feel very passionately about. And part of the reason is because it's really at the core of nearly all health complaints that I see clinically speaking. It has some degree or it has some component of relevance to any health complaints. And, some people come in with, and their complaints are very specific to digestion. Oh, I have chronic constipation. Oh, I have maybe IBS, or I have Crohn's or colitis, or I have chronic heartburn. But sometimes people have complaints that are seemingly not related. They're concerned about their ability to, think clearly, or their attention span, their ability to make, people are concerned about their nutritional levels. Am I getting enough nutrients from food? Am I absorbing? And sometimes that shows up because they might have chronic skin conditions, whether it's a rash like eczema, rosacea, acne. Sometimes people are experiencing things like hair loss or thyroid dysfunction. Sometimes people have an autoimmune condition, and it seems like the immune system is dysregulated, and they're trying to figure out, does my body need something to help support that regulation? And as I mentioned, cognitive health, brain health, also, prevention of dementia, or just trying to optimize cognitive health to keep things functional, and keep people feeling good. I see a lot of people with mood concerns, whether anxiety, depression, or anything on the spectrum, quite honestly. And so oftentimes we are looking at, are there any nutrients that are missing? Is there something that's affecting the gut health? Because we now know and have very good evidence to support the connection between gut health and brain health. So as you see over here on the left, there are a host of things that the gut does. And this is a very simplified explanation. We've got it helps with brain chemistry balance and behavior. We know that certain neurotransmitters are produced in the gastrointestinal tract, and that can directly impact our behavior and our mood. We know that the GI tract is where we absorb our nutrients. Macronutrients refer to like protein, carbohydrates, fats. Micronutrients refers to your vitamins and minerals, calcium, zinc, magnesium, B vitamins, vitamin B12, folate. And so for that reason, it has a very important role there. It's also important for immune function, and it offers us a lot of protection against infections. And those infections can range. So it's important. We want to make sure our digestive tract is functioning optimally to protect us. And then just regulation overall of the microbiome. So the microbiome, many of us have heard of this. It is sort of the flora. That's a general term we say for all the bugs that exist. And we have bugs all over our body, but we know that we have trillions of bugs in our gastrointestinal tract. And we are growing in terms of our understanding of what those bugs do. And they do all of these above here. They can also help lower inflammation. And honestly, there's a lot more we haven't learned yet that we're probably going to learn in the future about what they do for us. So there's a lot. Our gut is very, very important. But part of the reason, or part of what I'm going to do first before we talk about how we can support our digestive health, is I'm going to actually dive into how our digestive tract works and what I am referring to when I say digestive health. And the reason why I'm going to do this is because I have found that there are a host of medications, there are a host of remedies, there are a host of dietary recommendations out there, and everybody's very confused about that. And honestly, I see a lot of digestive symptoms that sort of get neglected and ignored for a really, really long time. And I think sometimes it's because we just don't really understand how the digestive tract works. And while my goal is not to bore you with a physiology lesson. I do find it's super helpful when I explain this to my patients, because there's almost this aha, and this light bulb clicks and goes on in their head like, oh, I didn't realize this is how the digestive tract works. Now that I understand how it works, why I do certain things and how I do certain things, it makes a lot more sense why those things matter in terms of my overall health. So, when we're talking about the digestive tract, I try to remind people this starts even before you take your first bite of food. Just smelling your food can activate the olfactory receptors, which are, the receptors that lie in your mouth, on your tongue, in your nose, and those go directly to the the olfactory receptors connect directly to your brain. And the reason why that's important is because that's going to actually activate your vagus nerve. And for those of you that already know this, the vagus nerve is going to control, it sort of regulates our parasympathetic and sympathetic nervous system. And for those that maybe don't remember or need that reminder, the sympathetic nervous system is like that fight or flight. And the parasympathetic nervous system, we call it the rest and digest. And it's called that for a reason, because when our parasympathetic nervous system is engaged, it contributes to, or it sort of supports proper digestion. So when people are looking to me for all sorts of support for their digestion, I say first step is actually just smelling your food. And if you can't make your food, if you're not in a position to be able to make every single meal, that's fine. Sometimes it's just a matter of taking a deep breath in before that first bite. The next step I try to explain is actually chewing your food. We can't, it's important not to forget that our saliva contains really important digestive enzymes, and that's designed to start the digestive breakdown of the food that we're eating. So you think about two things are happening when we're chewing. The mechanical, the actual chewing part of mastication, the chewing part actually breaks the food down into smaller and smaller bits. So that's one important piece. The other important piece is that the saliva that is coming into contact with the food is starting that breakdown process. So, so important. And we'll talk a little bit more about how that can get bypassed. The next important thing is going to be stomach acid. Now, this is something that can be a little, it's tough because there are many, many people that are on various medications that can inhibit or keep our stomach from producing stomach acid. And this is something where you really do have to work with your healthcare provider around this, because, if you're taking one of those medications, as you already probably know, you can't just go off cold turkey. If you do, and you've been taking a medication like that for a long time, it's going to be pretty uncomfortable. So it's not recommended. However, it is important for our bodies to have some degree of stomach acid for a few different reasons. One, because that stomach acid is needed to activate and support the absorption of vitamin B12. And vitamin B12 is a nutrient that's super important for our brain health. It's important for our skin. It's important for our senses. It's important for our mood. So if we're not absorbing B12 because we're not producing enough stomach acid, short term, no big deal. And that's why many of those medications were originally designed to be used short term, a few weeks, maybe a few months, and so the body can recover from that. But if you're using a medication like that over the course of years, that's where you might start to see symptoms of B12 deficiency down the road. Another important mineral that requires stomach acid to be absorbed is calcium. And so that's another reason why we want to be really mindful about people who have been taking if you're not producing enough stomach acid over the course of years, that can start to affect bone density. So those are two major things. They're not the only ones, but they're pretty significant. And stomach acid is also super important in terms of protection. It is, because the name implies acid, so that means it is very acidic, and that is a very hostile or unfriendly place for bacteria. So you have certain bugs that will not survive stomach acid, and that's on purpose. That's the body's innate way of protecting you against infections. It's kind of cool. Interestingly enough, stomach acid is one of those things where if you have too much, that will be uncomfortable. You might feel that reflux sensation, but not enough can also make it more difficult to trigger, the closure of what we call the lower esophageal sphincter. The lower esophageal sphincter is this band. I call it a band. It's like a muscle, kind of a sphincter is like a muscle / ligament, and it tightens, and that goes right between, it's like right where the esophagus, which is kind of like when you swallow something, it goes down your throat or your esophagus. And then eventually it's going to go into your stomach. And there's a band here that will tighten up so that anything in the stomach doesn't go back up. And if we don't have enough stomach acid, sometimes this can get loose. Now, other things can cause that to get loose too. If we're eating inflammatory foods, it's very common for this to sort of stay slightly open. And then that's why we experience sort of that reflux, because that stomach acid is hanging out in your stomach is going back up, and that is not pleasant. Lastly, stomach acid is really important because it sort of triggers everything else downstream. So, we still have a lot of steps to get through here in the digestive function or in the digestive process. And having enough stomach acid will trigger the pancreas to release more digestive enzymes. It will trigger, it also, in the stomach, you'll see some other hormones released that will then stimulate, the gallbladder and the liver to produce bile. And these are pancreatic enzymes, and bile then further support like sort of the last bit of breakdown of food. So this food goes into the small intestine, which, looks like a bunch of curled up tubing here. But the small intestine being very important, it's where we absorb a lot of our nutrients and we sort of get the final breakdown of food. So as you can see, if we start up here and we aren't chewing our food all the way, and then it gets into the stomach and we don't have enough stomach acid, by the time it gets into the small intestine, if you're literally, you don't have properly chewed food, so the bits aren't chewed up all the way, they're not being broken down, you can start to see how those all can contribute to feeling a lot of digestive upset. So here's just another look, again, for those that like anatomy and physiology, this is going to be great. For those that don't, you're going to be like, oh my gosh. But I think it's a really important look at how in the stomach, we actually have pepsin and acid that combine, and these sort of make up what we call your gastric juices, or a lot of people refer to it as, stomach acid, which is sort of like a very generalized term. But the idea is that this is really important to break down protein, to absorb those nutrients, and to stimulate everything else downstream. It's pretty cool and fascinating, actually. And then, as I said before, just a closer look, after the food comes out of the stomach, now it's got to go through the small intestine. And small intestine and large intestine are super important. The small intestine is where we absorb a lot of our nutrients. And the reason why this is important is because, like I said, visualize this. This is an oversimplification, but imagine you swallow your food without really chewing it. So you've got like literally huge chunks of food going into your stomach, and maybe you have some stomach acid in there, maybe you don't have optimal amounts, and your body's going to try to start breaking those down. And then as it goes into your small intestine, maybe it's not quite as broken down as it normally is. So now your small intestine is trying to absorb nutrients from things that aren't completely broken down. It's going to be pretty tough. So then what happens is people often sort of get what's called fermentation in the small intestine, and you start to get gassy and bloated. And sometimes this fermentation can also start to work upstream too, where people can start to feel kind of like heartburn or discomfort. You feel it kind of like right below your sternum, so, and then sometimes that can even result in reflux. So, again, a lot of functional gastrointestinal disorders that I see in practice can often result just from the simple act of not chewing. The large intestine is super important because this is where we have some production of nutrients. So our microbiome, or the flora, the bacteria and whatnot in our large intestine, will actually produce vitamins like vitamin K. But their main responsibility is going to be to sort of absorb water and then also to eliminate. And so kind of puts all the fiber that you've eaten, combines it with all the waste, and then your body can just eliminate that out. So there's a lot of different parts to the gastrointestinal tract, and each one is very, very important. The next question is, where do things go wrong? So I like to sort of think about, when I look at these, I sort of categorize things. And of course, this doesn't apply maybe to every single one, but this covers a lot of bases. And the first one is just, taking too big of a bite of food and not chewing it all the way. So if you've ever watched the movie Elf and Will Ferrell and how he loves his spaghetti with maple syrup, it's hilarious. But the idea here is that, sometimes we're just not being very mindful when we're eating, and so if we're taking larger bites of food, depending on how mindful you're being when you're chewing, you may or may not chew that food all the way. Likewise, there's a lot of stress eating or eating on the go. And so that's something we're going to talk about as well, because that can definitely impact how well or not you digest and absorb your nutrients. And then, There's also cases where, obvious ones are going to be if someone has a gastrointestinal infection. So say you go camping and you get ill after drinking some water that's maybe not purified all the way, or maybe you got some food poisoning after eating out, or maybe you went and traveled abroad and you encountered some bugs there and you got sick. Usually they're what we call self-limiting and they don't last forever. Usually the body has mechanisms built inside to help you eliminate if you encounter an infection. That's the good news. Sometimes we need some medicine to help us with that, and that's okay as well. Medications. And so I put these on here because these are the ones that, we encounter the most. They're not the only ones. These happen to be digestive aids. So the Prevacid, the Nexium, the Prilosec, these are, and then there's generic versions of these. These are all sort of stomach acid inhibiting medications. They're commonly used for heartburn. It's not uncommon for people to be told, go ahead and take that if you're just experiencing heartburn. And like I said, for short-term relief, totally makes sense. But if you're one of those people that gets chronic heartburn every time you eat, then that's something to talk about with your healthcare provider, because that could be a sign that there's something else going on that you need to explore, whether you're eating foods that are inflammatory to your body, or maybe there is something going on with the way that your digestive tract is designed. Some people have a hiatal hernia, and that can impact and put them at risk for having heartburn. These are all things to consider. But these are the most common medications that I see. Certainly they're not the only ones. And then lastly, I put this picture over here, although this is a very it doesn't have much of a description, but the idea is that, some people have certain conditions, or maybe they've had a surgery, something that has impacted their bowel. And so just as a review, and that could be any number of things. These are just a few, but if someone has had Crohn's, colitis, and maybe they've had to have a part of their bowels removed because it was maybe infarcted, or it was damage, or maybe there was cancer in a certain part of the bowel that had to be removed. And so knowing someone's history in terms of, have you had any part of your digestive tract removed, or have you had any surgery on any part of it, can certainly impact how well you digest and absorb certain nutrients. I also say that too, because depending on what part of the gastrointestinal tract has been affected, I always ask this question of people, because if it's been, say someone has had a gastric bypass, for example, then I'm going to be thinking right away, okay, this person's going to have really specific needs in terms of how much they can eat at one sitting and what nutrients they might need extra help in terms of supporting their body's levels of those nutrients, mostly because they may or may not be absorbing really well from their stomach, and therefore we might need to supplement with that. Same thing with celiac, depending on how active the celiac is. If someone has not been avoiding gluten and they have celiac, that will affect the lining of the gastrointestinal tract, and it will affect your ability to absorb certain nutrients. And so again, I might screen for more nutritional deficiencies there and supplement if I know that they have diagnosed celiac and they have not been avoiding gluten. So this is just kind of written out what we had before in pictures, things that can affect your digestion: infections, certain gastrointestinal conditions, eating on the go and stress. I will say with stress, what's interesting about stress is, as we all know, stress will increase levels of cortisol. And cortisol is that adrenal hormone that sort of puts you into that fight or flight state. And remember, when we talked about digestion, we talked about wanting to be in the rest and digest state, which is the parasympathetic state. So if you're in the sympathetic overdrive state because you're eating on the run, or maybe you're trying to cram in a meal between meetings, it's tricky. We all, when in this day and age, we're overscheduled, we've got a lot on our plates, even in the era of working from home, for as maybe some of you are doing, doesn't mean our schedules are necessarily less full. So sometimes you still have to really schedule out time to eat. Cortisol levels, when they're increased, will decrease secretory IgA. Secretory IgA is this part of the immune system in the gastrointestinal tract, and that's what helps both protect us against infections. It will also help our bodies tolerate foods. It helps our body distinguish between friend and foe. And if we have too much or too little secretory IgA, that can disrupt that function. And that's where things start to get wonky. I've seen people under chronic stress for a long period of time, maybe months to years, and they start to notice things go really wonky with their digestion. They're like, gosh, I feel like I'm reacting to everything I eat. I feel like no matter what I eat, I just can't tolerate anything. Part of it, it's not so much the food they're eating. Part of it is the fact that their body's under a constant state of stress, and that is impacting their digestive tract and function. So it's something to think about. And then lack of chewing, which we talked about again, and I'll say, we'll have a quick exercise here in just a couple of minutes that we can go through and try on for size. Just mindful eating can be super helpful with this. I had an instructor years ago who once told us we were supposed to chew our food 32 times, which, if you've ever tried to chew your food 32 times before you swallow it, it is really challenging. And it might be a little bit extreme. So what I explain to people is aim for 11 chews per bite. Try that and see what happens. You might notice a huge difference than what your norm is. You start to really become aware of what your tendency might be currently. I noticed for myself, I tend to reflexively want to swallow after maybe 2 chews. And if I really force myself to chew thoroughly, it's quite remarkable. And then, as we said before, chronic use of medications, and then intake of inflammatory substances. Now, this last point right here is pretty, I'll admit, it's pretty vague, it's pretty broad. That can mean a lot of different things. When I say intake of inflammatory substances, we're going to talk a lot about this next week when we talk about really individualizing or personalizing those recommendations. Broadly speaking, inflammatory substances include things like alcohol or refined sugar and candy, things like that. If you're someone who has celiac, for example, then gluten would be inflammatory for you. If you're lactose intolerant, then dairy would be inflammatory for you. So, and then there are some people that have found, there are other food groups that people know about, like, oh, if I eat spicy foods, that aggravates me. Or if I eat nightshade foods, that can be aggravating to them. So when you talk to people, you'll notice or you'll hear people say, oh, I know this food aggravates me. And so that's, again, what we're going to talk about tomorrow, or next week, I should say. But for the purpose of today, I usually tell people sometimes the most inflammatory food is the stuff we forget about, like alcohol, sugar, processed foods, foods that have a lot of extra added ingredients that aren't necessarily food, a lot of chemicals in them. Those are kind of the basics. And I'll just remind you here, as we start to talk about what we can do to support our digestion, you're always welcome to type in any questions. There's a chat section if you're watching this live where you can type in your question, and I'm happy to answer any questions along the way. We'll also have a couple minutes here at the end to answer questions, so you'll have more time then. But I just want to make sure everybody knows it's okay to ask questions now or at any point along the way. So what can we do to support our digestion? I really liked this comic. I thought it was hilarious because I do feel like this is a lot of what I see nowadays. And this isn't a knock at all on anyone who uses Tums. I think it can be like any other tool. It can be useful in certain circumstances. But, this woman's like, hey, I know that lasagna gives you heartburn, so I mix some Tums into it. It's sort of like, okay, well, let's talk about that a little bit. I think food is a really, I think food is a topic that can bring up a lot for people, and that's really understandable. And for me, I try to really respect that in each individual. I'm not really a fan, if you've listened to any of these along the way, you probably know this about me. I'm not really a fan of a one diet fits all sort of thing. I'm really a fan of people having a balanced relationship to food. Now, that said, sometimes we have to do therapeutic trials with certain foods or diets, and diets are sort of a really structured way for people to try to learn some information about their body. So I really try to help people understand that I don't necessarily think diets are like a one size fits all, you do it for the rest of your life, because your body is always changing. It's always evolving. However, what you eat can absolutely affect you. And I think it's important information to get at. Now, we also, along the way, have to talk a lot about our emotional connections to food and our emotional relationships, because those can certainly play a role in things. And I've certainly seen and worked with people where they knew certain foods were absolutely causing symptoms in them, but sometimes we have habits, sometimes we have emotional connections to food that can be really hard and can take a lot of time to sort of work through and sort out. So it's not a judgment at all. It's just sort of, I think acknowledging it it's a very important thing. So, I think maybe lasagna is a really important meal for them and they really enjoy it together. And so this is their way of sort of making the best of it. So, but in all seriousness, what I recommend are the following. And so let me be clear, these are really basic foundational recommendations. And so for a lot of you, this might not seem like new news to you. It might be like, well, of course these things are important. And maybe you even do some or all of these. And if you do, that's awesome. I find it's not an all or nothing. I find trying to do maybe one of these a day can sometimes be a challenge, and sometimes all of them happen and it feels great. The reason why I focus on this for today is because, I work with people where there is a constant questioning and desire to sort of like, hey, can I take this medication? What supplement should I take for this? I'm having these symptoms. What can I do for that? And there are many different digestive aids out there. You have digestive bitters, which are bitter herbs that you can take. And we've talked about these in past sessions. There are digestive enzymes, which are literally like encapsulating some of the enzymes that your pancreas usually secretes, so that you take those with food to help break down your food for you. And in some cases, those supplements are really important. If someone has a diagnosis of, say, pancreatitis or pancreatic cancer, where their pancreas is no longer functioning, it's not secreting those important enzymes, those digestive enzymes, those people you're going to need some digestive support. And you've likely already received that support, those recommendations from your providers. For people who have not necessarily been diagnosed with something like cancer or something like Crohn's or colitis or even gastritis, these are things that can be really helpful to implement before we start implementing digestive aids. Because sometimes the supplements, what will happen is people will take them and they'll say, oh, I feel better, this is amazing, but we haven't necessarily addressed the underlying cause of why those symptoms were there in the first place. It's really great that they have some relief, but I want to make sure that they continue to feel that relief. And if in the absence of addressing the underlying cause, my experience is that those supplements will last, like the benefit will be kind of short-lived, meaning it might last a month, maybe it'll even last 3 months, but without changing any of these things, usually a time comes when people will say, I used to take digestive enzymes in the past, but they just don't work for me anymore. Or worse yet, people like the digestive enzymes just aren't doing anything for me. And it's because we haven't done these things here. So mindful eating, we're going to go through this exercise here next. These other ones are going to be a little bit more obvious, and we've talked about these in other sessions in the past, but I'll say them again. Staying hydrated, so making sure you're drinking water throughout the day. Interestingly enough, I try to have people avoid drinking large quantities of water while they're eating. I have some people that say, well, I need the water to swallow. And it's true. I have some people with certain mechanical issues with their throat, or maybe they have Sjogren's or some other type of secretion condition where they can't secrete saliva and so on and so forth. So they actually do need water, but the majority of people, they're just not chewing all the way. So they're not working up their salivary production. So we try to focus on that and then gradually sort of see if over time they need less and less water during meals. Again, emphasizing intake, whole foods. Try to just eat, the more you eat whole foods, the more fiber you're getting, the better that's going to be for your motility. Eating pre and probiotic foods every day. We've talked about this in the past. There's a whole talk about that, so you can go back and listen to that. And I'll put up a list here in a couple of slides so you can remind yourself of what those are. Minimizing intake of processed and inflammatory foods. Again, we're going to talk a lot about inflammatory foods next week. And then not forgetting to move your body every day. That is part of helping support your digestive process. Moving your body both helps with contraction of the smooth muscle in the gastrointestinal tract, but it also helps regulate that sympathetic and parasympathetic balance, which is important for digestion. So, mindful eating exercise. Maybe some of you have already done this. So what I'm going to do is I'm going to invite those that are participating, and if you're watching after the fact, I'm going to invite you to just take a minute here, and this doesn't have to take a long time. So maybe you already have your lunch in front of you, maybe you have a snack in front of you, and if you don't, that's okay. You can still sort of go through the motions. I always encourage people, whatever you're eating, go ahead and have a seat, first of all. And if you have to stand, that's okay too. Take a moment to put your awareness on the bottom of your feet and really try to feel that connection of the bottom of your feet to the ground. So if you're sitting, it means you're connecting those feet to the ground. If you're standing, you're feeling the connection of both feet equally to the ground. Then go ahead and take one deep belly breath. So what that means is when you breathe in, try to breathe in through your nose. And as you breathe in, kind of fill your abdomen. You should feel your belly expand. Take that full breath, even let your lungs expand. And then gently let that air escape your mouth and blow out. And then now, go ahead and take your first bite of your meal or snack. And this time, go ahead and try to consciously chew it 11 times, for example. Maybe you want to do a couple chews less or a couple chews more. As you're chewing it, put your attention towards what you're experiencing. Is there a smell to the food? What does the food taste like in your mouth? What's the flavor? Do you hear something as you're chewing it? Is it crunchy? Is it soft and smooth? And note if there are any changes as you continue to chew that bite. Does that change at all? Does the texture change? Does the flavor change? And after you've chewed that bite 11 times, go ahead and swallow it. And then take one more deep belly breath before your next bite of food. So this right here is a really simple exercise that even the most busy, overscheduled person can try on for size. Now, some people say, well, I don't have time to do that for the whole meal. And I say, for a starting point, I think it makes sense just to do that with your very first bite. Let's not worry about the rest of the meal. Let's just take it one step at a time. Do this for the very first bite of every meal or snack throughout the day, and that alone will start to shift things. And you'll see how things feel easier to implement over time. And again, this is all geared at sort of supporting your nervous system, really making sure you're in that parasympathetic state so that your body can actually digest your food, break it down completely, and then absorb those nutrients. So just a reminder, I know we talked about this the other week, but in case you weren't with us that week, probiotics, prebiotics being sort of the food for the probiotics being sort of that beneficial bacteria and bugs in your gut. These are so important for making sure you have good motility. So regular bowel movements. They're also important for regulating your immune system, your hormones, eliminating So again, yes, you can take supplements for this, and it's not uncommon to see people take them and sort of experiment with them on their own. But for those that want to know, well, what foods will support those levels? And I put them all right here. And what's really interesting when you look at it is, there are the probiotic foods. Those are the ones with they've been fermented and they actually have bacteria in them. But what you'll notice is a lot of whole foods, anything with fiber really, is going to act as what we'd call a prebiotic. And up here, you've got some really heavy hitters. You've got garlic and onions and dandelion greens. I mean, you've got a lot of variety here. To play around with. And I'll point out just at the bottom, another really important thing in terms of digestive health is a variety of foods. As we talked about in the last session, the more variety of foods, the more variety of flora in your microbiome, which can be beneficial. And then don't forget on the other side, again, I don't like to tell people, don't eat this or don't eat that. I really like to focus on what we want to put into our body. However, for people that want to know, well, what are the effects of these other foods? Well, there's more and more research coming out about the types of effects they have on the gastrointestinal tract. And as I said before, things like alcohol, things like sugar will actually create inflammation in the gastrointestinal tract, which can certainly cause symptoms. And certainly antibiotics, we didn't talk a lot about it today, but they sort of go hand in hand with infection. Antibiotics can certainly affect digestive health. And that's why more and more people will take a probiotic after they complete their antibiotic treatment. That's to sort of replenish the good bacteria. In some cases, there's a certain subset of people who will take an antibiotic and then their body has difficulty sort of recovering proper function after that. So lastly, I'll just put in a plug again, exercise or just moving your body, so important for your gastrointestinal health. I know it feels like a weird connection to make, but it both balances the nervous system function, but it also supports actual motility and stress management. So meditation and mindfulness, I like acupuncture because I do acupuncture, but not for everybody necessarily. And then last thing I'll say, we didn't spend a lot of time on this, but if someone's never done this before, sometimes this can be a good exercise, especially if you've never worked with a nutritionist or a naturopathic doctor around food and understanding your digestive function. Sometimes I encourage people, this can be a good exercise to sort of keep track of food intake over the course of 3 to 7 days. But it's really not just about food. It's not a thing to use to judge it's not about that. It's really a good learning tool because what you can do is kind of identify, I'm looking for what's the timing of your meals? What kind of cravings do you have? What's your energy like? How are your bowel patterns? And are you having any other symptoms? Gas, bloating, heartburn? Commonly I hear people come in and say, oh yeah, I just get a little bit of gas. It's normal. And I said, well, what's normal for you? And people, it's amazing how many people think like gas after each meal is a normal thing. Just because it's common doesn't mean it's normal. If our body's properly digesting everything, we shouldn't really have a lot of gas after each meal. So that can be a huge, really good information when working with someone to understand where there might be an issue in the digestive tract. So I tell people, if this feels like a good fit for you to try this on for size, you can learn a lot from it. I always try to watch for people getting overly focused on, judging what they ate. It's really not about that, because to me, it's more important to know what kind of patterns there are first. So there's just a couple minutes left. I want to respect everyone's time. Please feel free to type in any questions you might have about today, or maybe in past talks. While people are typing in questions, if there are any there, I'll just remind people we now have wellness offerings for patients and family members. So this is open to anyone who's interested. My colleagues Teresa and Debbie are now both offering mind-body training sessions and health coaching sessions. So as you can see the information down here, sessions they're not covered by insurance right now. So it's a cash pay service or direct pay. Could also use a health savings account funds if you have those. But definitely use this contact information and reach out if that's something that you or someone you know might be interested in. And again, if you didn't already know, you can always reach out to us. Let us know if you want to get on the mailing list to stay informed about future classes and any other offerings. Awesome. If there are no questions today, I'll let you all get on with your the rest of your day. It's beautiful out there. I hope everyone gets a chance to enjoy the beautiful weather, and I look forward to seeing everyone next week. Have a good afternoon.